Another beta-lactam antibiotic we're going to see is cephalosporin. So please note, this is also a beta-lactam antibiotic, means to say that this also has beta-lactam structure. One, it cross-reacts with penicillin. Okay, that's why we are using aztreonam even for that, if at all. Now, yes, cephalosporins, please note a few very important things to note, and which, yes, it's an amazing thing to learn the generations. We're going to study some tricks today to learn them. Okay, so the general characteristics, very important, as well as the generation. So we're going to study the short forms to learn the generations of this bacteria. Okay, how to identify, and then we'll learn one by one. Okay, so how you go to identify the first generation, second generation, third generation. So second you have to wait, it's not right there. Okay, it's second generation you have to wait, and yes, then we'll go to the third, fourth and fifth. Okay, so I'll tell you what wait is, don't worry. So we're going to learn here today the generations. Okay, one by one, first generation, second generation. So I'll just connect them together. So how to learn first generation drugs? What is the short form there? Here the key is A after Ceph. So all cephalosporins have got Ceph. If A is coming after Ceph, I'll give you the example. It's a first generation. There is exception. We'll come to the exception in the end. Okay, A after Ceph. Now this is one thing which I've already explained in the detailed lecture, but again it's good to review them. A after Ceph. Now here I've just included the examples which has been asked. Okay, not all. So first generation A after Ceph. Just see Ceph A, Droxel. Ceph A, Zolin. Ceph A. Okay, so it's the first generation. Ceph A after Ceph, it's a first generation. Okay, so let's wait for second generation. We're going to go to the third generation. So all the third generation agents end with me 1 or 10. That's how you learn. So first is A after Ceph. Third is end with me 1 or 10. Okay, Ceph, me, Ceph 1, Ceph 10. Okay, so let's see what are the examples. So second, we are just waiting there. So what are the examples here? Okay, see, taximi, cefotaxim, ME in the end. That's a question asked. Then cefaperazone, 1. So me 1, 10. So again, ceftrioxone, 1. Okay, again me, cefixim, me, cefotaxim, me. Okay, so there is a, 10 not asked. If you see anywhere 10, you can just see that. Okay, detailed lecture is there in your app, explaining each and every example, but again easy. 1 May 10, easy, no? So that's the third generation. Now let's see what is the fourth generation, how to identify. PI in the middle. So first was A after Ceph, third was end in me 110, fourth is pi, pi in the middle. If you have pi in the middle, it's the fourth generation. So how? What is the example? Cefepime, cefepyrom. So the spelling is wrong, not priom, it's pyrom. Okay, cefepime and pyrom. Okay, cefepime and pyrom. Easy now, isn't it? Wonderful. So then finally, fifth generation end with rol. So it was pi in the middle, ending with rol. This was me 110. Third, A after Ceph. So fifth is end with rol. Okay, easy, isn't it? End with rol. So where is fifth? Yeah, ceftarolin. Okay, rol is there, or rolin in between, fine. Or ceftobiprol, or rol is ending. Okay, rol is there anyway. Rolin is there or rol is there. So that's about first, second, third, fourth, fifth. Okay, one thing we missed out was the second generation. So how to learn the second generation? That is exceptions. Okay, just exceptions, learn the exceptions. Ceph A, after Ceph, if A comes, it's the first generation, except cefaclor. Ceph A chlor, which is not first generation. So we studied after Ceph if A comes, like for example, we studied cefadroxil, Ceph A droxil, it's first generation, except Ceph A chlor, okay, cefaclor in fact, or cefuroxim. So if me comes, what would you say? Studied it third, no. If cefuroxim, it is second. So cefaclor, Ceph A chlor is second generation. Okay, cefuroxim, ME usually should be third, but it's second. Okay, so this is basically the first, second, third, fourth, fifth. It's very easy. Stop your lecture there. If you want to review the names once again. We're going to go to the spectrums. Okay, the spectrum of these drugs again was asked. First and second was compared. The question was like this, like for example, cefuroxime in comparison with cefazolin was like that. Okay, anything they can compare. So naturally, cefuroxime is second generation, so it has its spectrum. First generation has got its spectrum. So we are going to see the spectrum of each. Okay, the spectrum of each. So first generation, the spectrum is gram positive. Okay, first gram positive organisms. Okay. Here it is negative and positive, but negative is more effective. So 1 it is gram positive, 2 is negative and positive, but more effective against negative. So this is what the question was. Cefazolin is more effective against gram negative, opposite. Cefuroxime is more effective against gram negative again than comparison with cefazolin. Okay, it is a true statement. Okay, because second generation is more effective against negative than positive. Okay, and please note here only positive is affected. Here negative and positive is affected, but negative is more effective. Okay, third generation, Me10-1, the spectrum is again negative. So after 1, all are negative. Okay, that is 1 is only positive, 2 is positive, negative, 3, 4, 5 it's purely negative, no positive. So second is positive, negative. Now the key factor is 3, 4, 5 is more effective against each generation as it passed by, more effective against gram negative. See, you have penicillins for gram positive. What you need more is negative. So as cephalosporin generation becomes more and more advanced, it's becoming more and more effective against gram negative. Okay, so first thing, it's resistant to penicillinase by gram negative. So far no penicillinase, it was just gram negative. Here now it's one more is added, that is penicillinase. It's even effective against the penicillinase by the gram negative and also against pseudomonas. So we studied penicillins, anti-pseudomonal penicillin. Now we are studying anti-pseudomonal cephalosporins. Okay, we're going to study them. Okay, which is definitely no doubt this way. 1, 10, Me. Okay, so and also penicillin's resistance. Now, if you come to the fourth generation, so first was positive, second was positive, negative, negative greater than positive. Now here, penicillin is by gram negative and pseudomonas. If you see fourth generation, gram negative, more effective than 3, I told you, and also against pseudomonas, more effective against pseudomonas. So basically 3 and 4 is similar, except that 4 is more effective. Okay, then fifth generation, MRSA. Okay, we studied MRSA, we studied newly developed drugs, which is a fifth generation cephalosporin. Okay, which was besides we love CD, which was that we love CD in college, isn't it? So we studied the one was newly developed, which is against MRSA. Okay, so this is very, very, very crucial area. Okay, so spectrum is learned. Now, a few more points you have to note here. One is about the third generation. We studied the spectrum is very important against penicillinase resistance. So they can ask you, which of the following cephalosporins are effective against penicillinase producing organisms, gram negative organisms. It's majorly your third generation. Now, which is against pseudomonas, third and fourth generation. Okay, majorly. So here, few points to note. Few drugs to note also. Third generation, there is a very, very, very important drug. They always ask you the 110-me. One drug they always ask is ceftriaxone. Okay, 1. Okay, they've asked all these, but specifically some very basic details has been asked on ceftriaxone, that they are effective or drug of choice for girls' high school. Okay, just book it up. Girls' high school. So yes, I told you G was there. Where? Penicillin G, which was the gas gangrene. Here it's gonorrhea. I told you. Okay, then high. That is Haemophilus influenza. Please note it's a question. Both of these are questions. Okay, which of the following drug is effective against Haemophilus influenza? Ceftriaxone. Okay, gonorrhea, not gas gangrene. Gonorrhea. Then school, I told you Salmonella typhi, typhoid. Okay, there it was what? Tetanus. Okay, tetanus. So it's here salmonella. And finally, one more note here. These two, one, okay, ceftriaxone and the cefparazone, ceftriaxone and cefparazone, they have got one more problem. They inhibit vitamin K. Now, one drug which inhibits vitamin K is warfarin, which is used as an anticoagulant. Now, you can't give these two together. We're going to come to the question on that. Okay, you can't keep cefparazone, ceftriaxone together because it causes drug interaction and cause bleeding, because warfarin is an anticoagulant to soften the blade, which can, as a side effect, cause bleeding. Now, another drug which can potentiate the action of warfarin is these two, third generation drugs. Please note. Okay. Now, so that was about this thing, that is the third generation. Now, one more thing. We studied anti-pseudomonal penicillins. Okay. We studied the Me1 ain. Okay. So that's one exception, you can call it as ceftazolane, okay, or write it as ceftazole 1, okay, so that you remember it. It's what it says is Zane, okay. Anyway, basically the other thing is why I'm saying this is basically all these are anti-pseudomonal only, but there are three very important drugs: ceftazidime, cefparazone, and ceftazolane, which is more effective. If you don't remember anything, just remember one. The maximum anti-pseudomonal action is ceftazidime, which is third generation, so it's me. And just know that ceftazidime has got the maximum anti-pseudomonal action. Okay, that will be sufficient. So that was the first to fifth generation agents, and all the details, yes, has been covered. Okay, one thing, just to note, girls high school, gonorrhea, especially against penicillinase producing organisms. Okay, we studied penicillinase. The spectrum is penicillinase producing organism. So gonorrhea against especially the gonorrhea caused by penicillinase producing organisms. Okay. Now, some very general characteristics finally about the cephalosporins in general. One is they are ineffective against anaerobes, which is a true statement. You get confused. The gram negative positive is majorly aerobes. Okay, aerobic positive, aerobic negatives. It's anaerobes, it's usually ineffective. Cephalosporin, one thing very important to note. One drug very effective against anaerobe, metronidazole. Okay, just to note. I told you shows cross sensitivity with penicillins, and yes, this is very important. Inhibit vitamin K. Okay, I told you it has got same mechanism as warfarin, but very little, very mild. Otherwise, it would have been used as an anticoagulant. But now, if you give these two drugs together, that's a danger point. You can give them together. So, inhibit vitamin K, same mechanism as warfarin. So, that has got a synergistic effect. I'll come to the question very soon. So, yes, the question, everything I'll be discussing. So, basically, it produces hypoprothrombemia. What is that? Please note, vitamin K is important for very important clotting factors. 2, 7, 9, 10. We'll come to this when we study in detail about warfarin. 2, 7, 9, 10. For these clotting factors, vitamin K is important, and 2 is called prothrombin. So, if vitamin K is not there, prothrombin will come down, means hypoprothrombemia. So, what warfarin does is hypoprothrombemia. This also does what is hypoprothrombemia. Okay, then, so it causes a warfarin additive action. Okay, additive action on warfarin, thereby increase bleeding. Just one point to note here. How does vitamin K, how does it act? Warfarin, how does it act? We said warfarin and this cephalosporins has got the same, third generation cephalosporin has got not just third, I'll tell you which specifically. 2 drugs in the third generation has got the same mechanism of vitamin K. So what is the mechanism? Just to note here, mechanism of action of warfarin is it inhibits the enzyme called vitamin K epoxide reductase. VCOR it is called, vitamin K epoxide reductase, thereby preventing the recycling of active vitamin K. Means to say, active vitamin K is not available. Now, active vitamin K is very important for these clotting factors to be formed, okay, or activated. 2, 7, 9, 10. So, it produces hypoprothrombemia. Now, let's come to the question asked. Okay, two questions was asked related to the same concept. Let's discuss. That is, a patient taking warfarin along with ceftriaxone. Okay, that's like third generation, 1. Ceftriaxone, 1. Okay, and there was excessive bleeding being developed. There was excessive bleeding in this patient. Why is it so? That is, they take warfarin, ceftriaxone, excessive bleeding because, now you know it, very simple, synergistic effect. Okay, synergistic effect, both combined, same mechanism. Now, next, a patient on warfarin developed bleeding and increased INR. So, definitely, we studied this. There is warfarin additive action. Basically, warfarin causes increased INR, or you know that warfarin is monitored. How? By checking the INR. So, yes. So, in this patient, the patient is on warfarin, developed bleeding and increased INR when taken a particular cephalosporin. That's the question. Identify the drug. So, yes, it is third generation, 1. Okay, that is cefparazone. So, it can be either your ceftriaxone, that one, or this one. Okay, cefparazone. So, no two drugs, other drug is ceftriaxone. Third generation, 1. Okay, 2 drugs. So, even if they ask you, identify the drug, it's very, very, very simple. Okay, so that will be the end of cephalosporin. I think we'll need one more session to complete the the antibiotics, okay, and related things, because these are the key areas. What I've discussed so far is the most important areas. Now, what I'm going to discuss further is just very little has been asked in that. So, hopefully, one more session we'll be done with antibiotics. Thank you so much. See you in the next class. Bye and take care.